Hello everyone, my name is Zamre Rishikesh Shankar and my today topic for a daily task is the clinical research. We all know that the clinical research play a main role in human being. In that clinical research, the study of drug or new medicine on the human being. The main purpose of the clinical research is it is a process of discovering, designing and testing and gaining the approval for the new drug for the pharmaceutical component to ensure that the safety, efficacy, and side effect of the drug. Now, what is meant by clinical research? Clinical research is the branch of medical research in that the study which involve in human participants to understand their health condition and their treatment of the healthcare. And the main aim of the clinical research is to ensure the safety, efficacy, and side effect of the new drug or devices and what lifestyle changes of the human being after the use of the clinical trial on their perform. Then there are several phases of clinical trial. Main four phases of clinical trial. First of all, the clinical trial is the concept which is performed on the human being for the to check the performance of the drug and to check the adverse effect and side effect of the drug. After completion of the preclinical trial, all the data submitted to the INDA to get the approval for to perform the clinical research on the human being. Let's see the phases of the clinical trial. Main generally four phases of clinical trial that are phase 0, phase 1, phase 2 and phase 3. Let's see one by one phases of the clinical trial. First of all, the phase 0. Phase 0 it is also known as microdosing because in that phase normally 20 healthy volunteers which are involved in the phase 0 to check the uh, efficacy of the drug on these healthy volunteers. It is also known as microdosing because a very small amount of dose is usually in phase 0. Then phase 1. Phase 1, in this phase there are normally 20 to 80 healthy volunteers which are involved in the phase first, and in phase first the efficacy of the drug which is performed, which is checked. Then the phase second. In phase second there are normally 100 to 300 healthy volunteers are involved in the phase second. In phase second to check the uh, side effect and efficacy of the drug. Then phase third. Phase third it is also known as it is large scale operation. In that phase third normally 300 to 3000 healthy volunteers are involved. And phase third is also known as it is a most expensive phase, and it is required to last time. It is time consuming phase because the large number of healthy volunteers are involved in phase third. In that to check the safety and adverse effect of the drug and also check the efficacy. And in phase third check the pharmacodynamics properties of the drug, means what drugs does to the body. Then the phase 4. Phase 4 is also known as pharmacovigilance phase. In that to marketed the drug in the to for the marketing of the drug into market, the phase 4 is necessary. In that phase 4 to check the long term safety of the drug. This is about the phases of the clinical trial. Let we see what are the uh, where the clinical research it is performed. The first of all, the medical devices. In medical devices, clinical research is usual because the to check the performance of the medical device, what medical devices are produced and which type of medical devices are usually in clinical trial. Then clinical research also play a main role in the drug discovery. To in drug discovery to check the uh, performance of the drug and what type of effect the drug show on the human beings. This is the main role play in drug discovery. Also in a phase in clinical trial also study the behavior of the healthy volunteers or participants in the clinical trial. In that to check the behavior and what type of effect the people show after they performance of the clinical trial. When clinical trial performing on the human being, what type of behavior that show, any changes in there. This is all about the clinical trial. Then in last, the main aim of the clinical trial is to check the safety, efficacy and side effect of the drug. That's all. Thank you.